What is the most common dental problem that we see every day? It is a missing tooth. It can be a missing tooth in the front, it can be in the back, it can be your upper teeth, it can be your lower teeth. And the dentist will suggest that the best treatment option is a dental implant. And it is right. But is it possible to place a dental implant in each and every scenario? Mostly yes. But there are few scenarios where we cannot place a dental implant directly and we will require slight modifications. So let us understand about all these changes and modifications in this video. This video will be slightly long, but I will guarantee you that if you see this video till the end, you will understand about all possible options and you will be able to choose which is the right option for you, and you will not have to see any other video. So stay tuned. Hi, I am Dr. Suhaas, Chief Dental Surgeon, Oral Implantologist, CMD at Eledent International Dental Hospitals, Banjara Hills. We have branches in Kukatpalli, Kondapur, Manikonda and Banjara Hills. We are coming up with the latest branch in Suchitra, Kompalli very soon. So you can have a missing tooth in the front, in the back, upper or lower. Mostly dental implant placement is possible in most scenarios, but generally if you consider particularly the maxillary, which is the upper teeth posterior back region, then around this region from your first premolar to second molar region, generally there will be maxillary deficiency. Now maxillary deficiency means the amount of bone that is present below the maxillary sinus. There is a air filled cavity present inside this bone, and the bone below that is only the bone that we can use for placing a dental implant. So when that bone is less, and as we see in the x-ray, if it is less than 4 mm or 5 mm, then generally putting a straight conventional implant might not be possible. In that cases, let us quickly understand what all treatment options are possible. So there are 7 treatment options that are possible basically. So one is bone augmentation. The second is sinus lift procedures. Third is zygomatic implants. Fourth is pterygoid implants. Fifth is tilted implants. Sixth is distraction osteogenesis, and last seventh is overdenture treatment options. So let us quickly very briefly understand what all these procedures are. Bone augmentation means adding synthetic or natural sources bone particles or your own bone in a shape of a triangle or as desired, taken from any other region, and we place in the required region. Then we wait for around 4 to 6 months for the new bone to form, and then place an implant. So that is bone augmentation. Second is sinus lift. So whenever the bone in this region is less, we can do sinus lift. We can lift the level of the sinus by raising the membrane which is covering the sinus. So that procedure is called a sinus lift. It can be done in two ways. One is an indirect approach and one is a direct approach. Indirect approach is, suppose you remove a tooth, there is no tooth, then we use certain instruments and we push the membrane from that socket itself. That is an indirect method. Another technique is direct method, where we will make a small window. We'll open up the bone here and gain access to the membrane and raise it, and then we will put the dental implant. Third is the zygomatic implant. Now that the normal implant is not possible, we have to choose some other anatomy. So zygomatic implants are generally placed in the zygomatic bone, that is your cheekbone. Instead of putting your implant in this region, we use a cheekbone and we put long implants and restore it. Similarly, there is pterygoid implant. Pterygoid implant can be placed only in the posterior most region. So there is a hard bony structure called lateral pterygoid and mesial pterygoid and pterygoid plates. So we can put a long implant in this region, that is called a pterygoid implant. Then we have another option which is a very good option, where instead of putting the implant straight in this region, we can bypass by tilting the implant slightly forward and bypassing the sinus membrane. This is called tilted implant option. So this is also a good possibility, but we should have enough bone, or the teeth in front should be also missing to place a tilted implant. Next is a distraction osteogenesis, which is a very rare procedure and a very invasive procedure, not very commonly done, where we can cut the bone and we separate the bone by certain distance, say 4 to 5 and we wait for that particular region to be filled with the bone, and like that we continuously increase to our desired level, and then we place a dental implant. And finally, the seventh one is an overdenture. Here we do not place implants in this region at all. This is a case only useful for complete restoration, where we will put 4 or 2 implants. If it is mandibular, we can just put 2 implants. If it is upper teeth, we need 4 implants, and we don't put implants in the posterior region, and we can restore with a denture which is removable, partly removable. So there is a button system where we can just press the denture and it fits perfectly onto the implants. It can be removed as well. So these are all the 7 techniques that are possible in case you don't have sufficient bone, and in cases where regular implant is not possible. So visit your dentist, get the 3D CBCT X-ray done, OPG done, and understand exactly your scenario, and choose the right method which is suitable for you. If you have any queries regarding this technique or all these options, you can reach out to me by calling the number given below. You can book an appointment or consultation with us in any of our branches, and we'll be happy to assist you. Thank you.